Snigdha from justdakhila.com. We have here with us Dr. Neevita, who is a speech and hearing therapist. So before starting anything else, I would like to know what exactly is speech therapy?
Well, speech therapy is a treatment, is a rehabilitation treatment wherein we treat children and adults with communication, voice, neuro disorders, or any disorder that has to do with swallowing. Any of the articulators of our mouth is not functioning. We treat those things with speech therapy.
So how can speech therapy help a child?
Children can have communication problems in varied ways, like articulation. They are not able to pronounce certain sounds correctly, like r, l. They substitute some of the sounds with other sounds. Some of the consonants are not very clear, so they can be treated with speech therapy. Some children have fluency problem, like they are not very fluent and they break while speaking. In this condition, we call it dysfluency or stammering. So that also can be treated with speech therapy. Very small babies can have swallowing problem, with premature children, infants, and there are other conditions wherein they are medical conditions wherein they are not able to swallow food. So that can also be treated with speech therapy. Some adults and children have voice problem. Their voice is hoarse, or there is a nodule, or there is some growth on their vocal cords, where their voice quality or the sound quality of their voice is not normal. Either it is very hoarse or it's harsh. There can be varied terms for it. So that can also be treated with speech therapy. Then some of the teenage get into in puberty. They are not able to, male especially, they are not able to change their voice. They are suppressing their voice. We call it puberphonia. So that can be treated, the right frequency or the right intensity of the voice, if they are not getting, that can be treated with speech therapy and voice therapy. And there are lots of neurological conditions in adults, like aphasia, where there's a stroke, or there's Parkinson's. So there are lots of such conditions, neurological conditions, wherein speech therapists can really help. Where speech, their dysarthria, they are not able to speak correctly, the words are broken. So there are different conditions. So there can be neurological condition, there can be swallowing problem, there can be communication problem. So all these conditions can be treated with speech therapy.
Which is the hardest one to treat?
I think the neurological ones are the toughest, because the prognosis, that is the outcome or the result, is very slow and can be difficult, and sometimes it can be very, very minimum. So that is one of any neurological condition is the toughest to be treated.
How would we know if a child needs speech therapy?
When the child is born, and if his voice is not sounding very, correct, or his speech is not coming. In children particularly, they have delayed speech. In these days, they have a nuclear family system. Parents are working and parents are not giving. These days, children are more on gadgets. They are like on laptops or mobile. You will see an infant carrying or playing with a mobile. So they don't feel the need to communicate, or they start signing. They are not using the verbal language. And we see at a clinic that the average age at which children used to speak earlier has got delayed. Now that will put academic pressure on the child, because the school admissions and everything. So talking or communication, verbal communication is very important, but for language development also, and to express your feelings. So there is a delay in that in these days due to advent of gadgets and nuclear society. So any delay in speaking, or if the child is speaking and the speech is not clear, not fluent, I would advise the parent should not wait. There is a myth that people say that अपने आप ठीक हो जाएगा, or it's not a big concern, but it will concern because there'll be overall delay in the child's growth, personality development. If he's not speaking, I have teenagers coming now whose parents have ignored their speech issues, and now they're themselves getting very conscious about it because now they are getting out of school and they're getting into colleges, they are facing interviews, and then it is too late to treat. So earlier the better. So any delay, if the child has not started speaking at word level by 1 year of age, then it's a matter of concern. If he is speaking by 2 or 3 but not speaking clearly, the child's speech is not understood by strangers, even if it is understood by parents, because parents get habituated to their wrong speech and they understand. Say for instance, if a child is saying "otter" for water, parents understand because he says every time the same thing, so they get adapted to their wrong speech. But if any child's speech is not understood by a stranger, or then it's a time when they should seek for a speech therapy.
What exercises should parents do at home with their children?
Well, they should do. Parents have a big role to play in speech therapy program, but they should not be doing of their own because they don't know. They should be guided by speech therapist or a professional.
Alright. So, by any chance, if they have consulted a professional and with the professional treatment, is there anything else that they should do at home?
Yes, they should talk to the child as much, give a right model of speech. Sometimes we see that there is a problem in the family itself. They are not talking enough, they are not giving time enough to the child. They are providing gadgets instead of, spending time with children. Some of the family, they themselves, the rate of speech is very fast, we have seen. So they should themselves be conscious about speaking it correctly. Basically providing the right model to the child. That's what they can do. Because once they see that there is some manifestation that is coming in children, they should look at themselves that there is something there's a lacuna in them. So that is the first step. And of course, they should also, because we generally don't tend to see our own issues. So if they go to a professional, they should be frank about their family environment, their other things, and so that a professional or speech therapist is in a better situation to understand what is the problem and should be able to guide.
So stammering is a speech defect. How can a person overcome that?
Yes, stammering is a fluency disorder, we call it. There can be various levels and degrees of stammering. I have seen lots of young children having stammering. That could be psychological, environmental. It is mostly psychological and environmental. So there is a program for that, a therapy program, and lots are driven. If it is in a child, parents have a big role to play in it. So as I said earlier, they can do a right modeling. First thing, they should not pinpoint at a child that you have a problem. Speak correctly. They should not always point out, because then it will only aggravate the problem. It will increase the consciousness in the child. So they should, instead of pointing out, speak correctly. They can model out the same thing in a, say for instance, he says, मुझे पानी चाहिए, अच्छे से नहीं बोला, and parent ने बोला कि आप अच्छे से बोलो. Instead of that, क्या आपको पानी चाहिए? The same thing he can model out in a better way. So make a positive environment around it. So stammering is quite psychological, and if they start pointing out, it can only worsen the situation. So my only advice to parent would be, in case of stammering especially, or any speech disorders, not to point out at children, because if they start pointing out, that's the first thing we do. ये कैसे बोल रहे हो? सही से बोलो. The moment they start doing this, they are building the consciousness in the child. And the treatment, because there is no medical treatment,
and it gets harder eventually.
It gets harder to treat those children.
what were the most difficult challenges that you've faced up till now in treating such patients?
Speech therapy.
Yeah.
Some of the stammerers are difficult, and especially when they grow older, because it relapses. It can happen again. So you've done all the hard work and changing everything, and then again it relapses. That's the very tough time for therapist as well as for the patient.
And in overall experience, what was the most challenging case in your life?
Challenging. Some of the neurological problem can be a challenging one.
Can you tell us about one of your experiences?
Okay, there was one child who had stammering from childhood, and we worked quite hard with him, and he was treated well. And it took us long time because to understand his problem, to understand his parents' issue and his psychological issue concerns, it really took us time. We also tried to go to his house and try to understand the whole scenario and helped him out of it. And
how long did that take?
It took around a couple of months for him to be on track. And then,
so you're saying this thing can be cured?
Yes, it can be cured. It can be cured.
It's not the end yet. Stay tuned for more.